Hi everyone, this is Dan. It is Thursday, February 7th. This is my 1 week post-op video of my gastric sleeve bariatric surgery. This has certainly been one interesting week. I am now down 10 pounds in my first week, and this is the fastest weight loss that I've ever had. And I don't expect it to continue up this long, but it's certainly very exciting. My scale has showed me today at exactly 230 pounds, and that's the lightest that I have been in I don't know how many years. And this is just the beginning, so it's pretty exciting. So first off, I would like to thank you for all of your support, all of you who have given me words of support on Facebook, who have left positive supporting comments. I really appreciate that. It means a great deal to me. Especially those of you who may not have agreed with me doing this type of surgery and who isn't in favor of doing these types of procedures. And even though you might feel that way, you still were extremely supportive and approved of what it is that I did. And so I greatly appreciate that. So anyway, the hospital stay was quite interesting. As I said, all this time I felt very convinced that this was the right thing for me to do. I felt very certain. But I gotta say, the moment that I woke up from surgery and I felt all of that pain in my stomach, the first thought in my head was, oh my goodness, what have I done? What did I do here? And, because it really hurt for a while. But thank goodness the first day I was hooked up to a morphine drip, so I was able to administer that every 8 minutes, however much that I needed it. So later on in the day, it wasn't quite as bad. I felt a good deal better the first night of the hospital. The second day is when they decided to discontinue the morphine. So at that point, it was a little bit more difficult to deal with, because then there was pain and I didn't have the morphine to rely on. So basically I had to tell them if my pain is on a scale of 1 to 10, and I said it was like a 4 or a 5, where the nurse said, well, if your pain is down there, then we could give you one of these vials for pain medication. If it's above a 6 or a 7, I forget exactly how much it is, then you get 3 of these. So each time they gave me one, I was almost tempted to embellish a little bit and make the number higher so I could get a little bit more. But anyway, I survived the first couple of days, and it was quite an ordeal. And I would just like to clarify what I mean when I say that it was an ordeal, because I remember at one point I posted that as a status on Facebook and had a whole bunch of people immediately getting so concerned about me, saying, oh no, well, what's wrong? And I think a lot of it is that certain of my Facebook friends might have read this status without seeing my previous statuses that I wrote, so they may not have understood what was going on with me. So they might have been alarmed and didn't understand what it was that I was referring to. But even a couple of people who did know that I was going through the surgery were a little confused by saying, well, I don't understand. I thought you said everything was going well. Well, everything was going well. Everything is going well. But just because everything is going well and everything's positive doesn't mean that it's also an ordeal, that it's also difficult. And just because things are difficult doesn't mean that things are still all positive. It's both happening at the same time. This is all a very positive step that I've taken in my life, and like many other people who I've seen on these video logs, they say that this is the greatest thing that they have ever done in their life. I believe at this point that yes, this is the best choice that I've ever made in my life. With that being said, it still is quite an ordeal. There's a lot of pain that I have had in my stomach, right in this area here. Now that it has been a week, much of the pain has subsided. There's still, mild, moderate amount of pain there that remains there. But each and every day gets better and better. So each day I heal more and more. And this past week it's been a purely liquid diet. The only thing I could have are protein shakes, water, jello, and chicken broth. And that's basically it. And what I noticed right away is what I did research on and what I was told about it is that people report never feeling hungry at all with this type of surgery. And I really find that to be the case, is that I have had nothing but liquids. I have had no food whatsoever. And a lot of times I feel like I crave food, I miss it, but I'm really not feeling too much hunger. As long as I keep myself hydrated and with the protein and all that, I'm basically doing fine. And the weight is coming off very fast, and faster than expected. And as I said, over the past week, it's been about 10 pounds, maybe a little bit more. Basically what I would like to do now, if it's okay with you, is some of you were asking about the type of incision that was made, that if I was cut right open, and basically this is a laparoscopic surgery that I got. So I didn't get one big cut down the middle like what used to be done in many conventional surgeries. But with laparoscopic surgery, there are 5 smaller incisions that were made in my stomach, so that there's not as big of a cut there. So to satisfy any of your curiosities and just to show you, I would like to show you the incisions. For those of you who don't want to see this or who are squeamish at all, I advise you to look away. So now's your last chance. 5, 4, 3, 2, 1. Okay, here I go. Look away if you don't want to see it. So as you can see, there's 5 small incisions that were made into my stomach. One on top here, 2 on the sides, 1 over here, and this seems to be the main incision that I figure that's where the surgery took place inside, because it's right in this area. That's where I feel all of the pain. And I guess this is where 60 to 80% of my stomach was cut out of me permanently, where I'm now just left with a small vertical sleeve. So that's the stomach that I'm now left with, and the stomach I'll be left with for the rest of my life. And it certainly feels very different, because even with a liquid diet, just a few sips of water, and it is full. I cannot gulp anything down in large quantities the way that I used to. This glass of water here, I'm going to drink as much as I possibly can and show you when I need to stop. Okay, that's it. My stomach is telling me right now that's all it can take. I can't drink large quantities at once. I need to sip a little bit at a time. I need to wait at least a couple of minutes and then sip again. But can't just down an entire glass of water. I'm able to take down a whole lot more than what I was able to in the first couple of days while I was in the hospital, where it was very difficult to really take down hardly anything in any type of quantities. A lot of times they brought me the meals, which consisted always of the same thing, of chicken broth, tea, jello, and I think an iced tea. And at most I was able to have just a few sips of chicken broth, maybe a sip of the cold tea, and then that was it. I just couldn't take anymore. And there was a couple of meals where I just had to skip it. I couldn't down anything at all. So there definitely is a lot less room in the stomach than what it used to be. So that provides some complications and some difficulties, but at the same time, that's really a big benefit. This is a restrictive procedure that really reduces hunger, and that's exactly what I need. And this is definitely something that's going to benefit me in the long run. This is just the beginning of my journey, the beginning of my weight loss. There's a whole lot more to come, and I'm really excited about it. And I look forward to sharing the rest of it with you. So thanks for watching all this, and as I said, please feel free to comment, and if you have any questions about it, please feel free to ask away, and we'll be in touch soon.